would like to introduce our speakers for this evening. Karen Rusbarsky is the Consumer Benefits Coordinator with the St. Louis ARC, and I am Ann Mangelsdorf, the Assistant Director of Family Support and Advocacy with the St. Louis ARC. We will both be your presenters for this evening, and without further delay, I would like to turn it over to Kristen to begin the presentation.
So tonight we are talking all about HCBS waivers or Medicaid waivers and Medicaid. I'm going to start us off with just the basic Medicaid as insurance and applying for Medicaid, because that is a very tricky subject. And there's a lot of ins and outs. But once you do have it, it will open doors for many different types of supports and health insurance for your loved ones or anybody that you support with a disability as well. A little basic information about Medicaid itself. Began in 1965 to help individuals with low income disabilities, or blind, help receive more health insurance or better funding from the state. It is a state administered program. It does have some federal government support, but mainly administered by the state. As of 2021, at the beginning of the year, 907,000 Missourians were covered by Medicaid. With Medicaid, there is a monthly net income that does have to be below $913. And your qualifying assets at any given time should be under $5,000 to maintain Medicaid eligibility. To apply for Medicaid, goes through the Family Support Division. Also with the Family Support Division you can apply for food stamps through them as well. And that's another great benefit for people that we support or anybody with a disability. Currently, our Medicaid does need to be renewed each year. Currently, because of the COVID-19 state of emergency, they are on hold until 2022. So as of right now, anything that is already in place with your Medicaid and your health insurance will continue over until next year. We are going to start off with applying for Medicaid. So Medicaid we can apply for both children and adults. When applying for Medicaid for children, it's called CHIP, Children's Health Insurance Premium. And with that, any family who does have low income or needs assistance, they can apply for Medicaid for their children. We're going to talk a little bit about children with disabilities. So with children with disability usually will qualify for MoHealthNet coverage. Medicaid in Missouri is called MoHealthNet. I did not say that, but that is what it's called in Missouri. With MoHealthNet for children, the family's income isn't taken in account as greatly if they do have a disability. So they take that disability in account greater than any income that the family may have. So along those lines, when you do apply for Medicaid for your child with a disability, you will have to go through a few different extra steps so that Social Security, MoHealthNet Family Support Division can determine that your child does have that disability, and thus you do need that extra benefit. For anybody who needs to apply for Medicaid, all the applications are done online. You can print off a printable version from there as well and mail it in. On the MoHealthNet website, which is mydss.org, you can apply for coverage through there for both children and adults. Medicaid coverage for adults. Same thing, we're going to focus more here on adults with disabilities and applying for MoHealthNet or Medicaid coverage. There also is income-based assistance for Medicaid for low-income individuals, but we are really just going to focus on that disability insurance. The Family Support Division, or FSD, does determine that eligibility. So again, through that same website as with the children's health insurance with Medicaid for children, mydss.org, you can apply for Medicaid coverage through there as well. Most SSI recipients are qualified for Medicaid. When you do apply for Medicaid for somebody with a disability, a lot of times they will already have that SSI benefit. In some states, unfortunately, Missouri is not one of them, If you do apply for SSI or supplemental security insurance, then Medicaid is automatically applied for, because a lot of times those go hand in hand. Currently, Missouri is not one of those states, unfortunately, so you would have to submit the application for both. However, they are very similar, so a lot of that same information you can pull over. When applying for Medicaid for somebody with a disability, you'll see when you visit that same website that there is a supplement, and that supplement is just a few additional questions for anybody who is blind or disabled to fill out as well to get that Medicaid coverage. When you do apply for Medicaid, this becomes your first step in moving towards receiving those Medicaid waivers or HCBS waivers. So with that, when you are thinking about where am I going, where do I need, what's the future for the person that I love with a disability, or that I'm supporting with a disability? Are they going to need residential services? Are they going to need day rehabilitation services, or even employment services? Those waivers are that next step. So we want to start by applying for Medicaid on that website, mydss.org. There's a lot of very helpful tips and tricks in there as well to help you get through the application. Big thing when you are applying for Medicaid for an adult child. So anybody who is 18 or older is considered an adult. And even if they have a disability, and even if they're still living with you, they are still considered an adult. And so when you do apply for Medicaid for that person, we want to make sure that we're filling out the application as if you were them. At the very end of the application, there is an extra document that says if you're filling this out for somebody else, you put in a little bit of information about yourself. I think just name, phone number, and I think signature, not much at all. That just shows that you are filling out the application for somebody that is disabled but is considered an adult. So in that case, their Medicaid or Family Support Division will just count in only their assets, only that person's assets, whether they get Social Security disability benefit, SSI benefit, or if they work, if they're employed, if they have insurance through work, whatever that may look like, it's only for that person. And then, like I said, fill out that supplement for the aged, blind, and disabled. So Medicaid as a health insurance coverage. So when we talk about Medicaid, especially as we dive more into the waivers, we want to kind of put on two different Medicaid hats. We want to talk about Medicaid as an insurance, so as going to the doctor and using it for coverage that way, but then also Medicaid as this support umbrella, this waiver, or this support that's going to give you this waiver to get the extra support that your person needs. So here we're going to just touch a little bit about Medicaid as insurance. Once you've applied for Medicaid, you'll want, if you are looking to go the waiver route, if there are extra needs that your person needs that can be supplemented by the waiver, we want to reach out to DMH or a regional office to start finding a support coordinator. They have people in place to help monitor those phone calls and get you in touch with the person that best will support that person's needs, whether they're still in their natural home, whether they're finishing up school, whatever age they may be. DMH will have people in place to help navigate those phone calls. Once we have that support coordination, that's when we want to, your support coordinator will then help you develop a strong ISP and really put in the need for that HCBS waiver. And Anne's going to touch a lot more on those here in just a few moments. So back to Medicaid as the health insurance. Medicaid covers many parts of healthcare, including doctor's visits, hospital stays, nursing home care. Will cover certain parts of children's therapy, such as speech, OT, physical therapy. And it can also help with some long-term long-term care costs, whether in a nursing home or at their own home with some in-home nursing coming to their house. We'll talk a little bit about in-home or residential services with all of our HCBS waivers, and those will be covered through the waiver and versus just Medicaid insurance coverage on its own. So to maintain Medicaid, even if for a lot of the folks that we support and that have a disability, it's important to keep that Medicaid in place and to maintain their eligibility for Medicaid. Mostly because if you down the line think that somebody that your son or daughter, or somebody that lives with you might need to move into a residential setting, we want to have that Medicaid in place because it'll take that first step off of the list of things that we'll have to do to get them in residential placement. So as long as we're maintaining Medicaid, we can just skip over to that finding a support coordinator and getting the waiver moving and in place. So in order to maintain Medicaid, assets do have to be below $5,000. So when somebody gets a Social Security benefit, if someone only has a Social Security benefit and they don't need Medicaid, they have SSDI benefits, and they do not need Medicaid, they do not have an asset limit. A lot of times you'll hear an asset limit for Social Security benefits is $5,000 because that ties into that Medicaid part of it. The Medicaid asset needs to be below that $5,000. People with disabilities are lucky in that they have two different ways that they can keep their Medicaid eligibility even if they are making over that asset limit or their monthly income limit. The most popular one, and I don't want to say easiest, but the easier one to maintain is the spend down. So think of a spend down as an insurance premium, something that you have to pay to maintain your insurance coverage. Somebody with a disability, these really do only apply to people with disabilities, they can pay a spend down to bring their monthly income limit below $913, which for 2021, that is the monthly income limit. And it changes just a little bit, about $30 less last year. So it will change a little bit from year to year as well. With a spend down, there are two different options that you can do in order to spend down and maintain your Medicaid eligibility. You can pay in, which, like I said, is paying a premium of sorts to come down below that $913 a month, or you can submit medical expenses. These medical expenses can be anything that they have occurred that current month or the month before. So you can submit medical expenses for the month prior, and that will maintain your Medicaid eligibility for that month. So once you've paid in to those medical expenses, you've met your minimum, and you are then have that coverage again for another month. If somebody works, they can have their Ticket to Work health assurance program. And with that, anybody who is working, ages 16 to 64, and they can also pay in that an insurance premium of sorts to help maintain that. If their income is over that $913, over that monthly income limit, they can pay in a premium of sorts to maintain that Medicaid insurance as well. The amount for that varies on the person, varies on the amount of money that they're making. Typically, it's between $60 and $100 for the Ticket to Work. But again, somebody does need to be working to use that. So a little bit more about spend down, because it can be a little tricky. There are a couple things that can play into what affects the spend down. Like I said, $913 is a monthly income limit to maintain that Medicaid. So here's just a very broad, high-level example. A person gets $1,500 per month in their SSDI benefit, their Social Security Disability Insurance benefit. They can spend down $587 to bring them down under that 913 and therefore keep their Medicaid and Medicaid coverage. There are things that will affect that 587 in this case. If the person already pays a Medicare premium out of their SSDI benefit, that'll take that 100. Currently this year it's $148.50. That'll take that $148.50 off of that spend down amount. If they pay a separate dental insurance, that premium will take off of that spend down amount. So there are different things that can play into what affects the spend down, and it can make it a little less as well. It may not seem important to maintain that Medicaid, especially when you're paying this much. But once you have that Medicaid in place and you've already applied for it, especially if you know that you're going to need more of those supports down the line, it is important to really do your best to maintain that coverage. Once the spend down is met, MoHealthNet will cover any of those other medical needs for the remainder of the month.
Kristen, we've got a couple of questions related specifically to spend down. One is any medical expenses that you can think of that would be disqualified from submitting for the spend down that they wouldn't accept.
I've not seen any. And I think even now, I mean, I think especially with COVID and everything, they're even taking, like, if you have like some sort of like copay with telehealth, they're being I think they're being a little more lenient with that now. But there's nothing specifically that I can think of that they would say, no, that's not covered.
Okay. And will Medicaid cover prescriptions?
So Medicaid does not cover prescriptions. Medicaid, we're going to touch a little bit on that in the next slide when we talk a little bit about Medicare. Medicaid does not cover prescriptions. I would have to look it up, but I think that you might be able to submit prescriptions to meet a spend down if you had to do that. But no, unfortunately, they don't cover those prescriptions.
And can you use the spend down on anything? Is it restricted in any way? I wonder if they mean
like as in paying for the bills, kind of like that first question.
Yeah.
So they do have to be medical related. So they do have to be, so keep thinking of that insurance part of it, medical insurance. So it does need to be medical related in order for that spend down to be met.
All right. And then this one was from further back. What does the annual renewal process look like? Do you know?
Yeah, so the annual renewal is once you fill out that initial application, the application each year is a little shorter. You can, and the very first time you fill it out, you fill out the long form, which is about 7 or 8 pages, and goes a little bit more in depth of finances and current health coverage. Again, kind of depends on if you're filling it out for just one adult person or the child. If it's a child, even a child with disabilities, they'll look a little bit at the family or the parent's income and other health insurance coverage the parents might have. But for a child with a disability, they don't dive as much into it. But like I said, the first time that you fill out that application, you're going to fill out the long form, which is about 7 or 8 pages. And then after that, you can fill out the shorter version, which kind of just revisits everything that you've previously submitted. And that one, I think, is only like 3 or 4 pages. So it's not that much shorter. It is a little bit shorter, though, once you already have that for that, the second, third, fourth, 12th renewal application.
And will people get a letter in the mail telling them they need to renew?
They are supposed to. I think, yes, they are supposed to. Also, my suggestion, and I suggest this to a lot of the families, is, even as, some people pull away from all of the, online stuff, I think, especially with Social Security and with family support division, use those online portals. I think they are really almost a better tool a lot of times to get that communication, because all of that, you log into your online account, your online portal account, and it'll have when your expiration for your Medicaid is, if you have food stamps, when your food stamps are up, and it has all that communication automatically regenerating. So I truthfully, like I said, as much as everybody, pushes online and pushes taking a break from being online, I think those tools are very important ones that actually might be a little better than, just waiting in the mail. Social Security and MoHealthNet and Family Support Division, that is a big thing though. They are supposed to always mail out the communications that they're sending as well. So you won't usually get a phone call saying, apply for your MoHealthNet coverage. If you do, I wouldn't trust it. But it should either be a mailed document or sign up and set yourself up on their online portals.
All right, and then we have MoHealthNet cards from a couple of years ago. Did not know we needed to renew each year. Never got any letters. So I think that's just a comment. So it might be good to track when it's due so that you can make sure within a month or two beforehand you can start that process.
Yeah, and you can also keep in mind that renewals stopped when COVID started. So even if let's say you've had, your MoHealthNet since June of 2019, once March of 2020 hit, they stopped their renewals. So you might have had cards, you might have had coverage for a while. And once they stopped those renewals, because technically if you applied June of 19, June of 20 would have been your renewal. So that's a possibility that you haven't gotten that communication. But you can also, that same website, mydss.org, you should be able to log in there and even just put in your MoHealthNet number and see how your coverage is active. I know there are possibilities. I know for the folks that we support at the ARC, we aren't able to do this, but you also might have been able to have coverage for multiple years. So I think on the application, depending on whether, how you're applying for it, you might be able to, choose a 2 or 3 year renewal on there as well.
And that was all the questions we had for the moment.
Awesome. Great. So I just had a couple other things I'm going to touch on. If you have a person that has Medicaid and they only have SSI, Supplemental Security Insurance, they won't have a spend down because for them, they can only get up to that $794 a month. I want to touch really fast before I shoot it over to Anne, just about Medicaid and Medicare together. So if somebody has Medicaid or has Social Security disability insurance benefits, after 24 months of having those benefits, they'll automatically begin to receive Medicare. So that's really helpful for a lot of families. If a child is getting the benefit off of a parent's either retirement, or if a parent unfortunately has passed and they're getting their disability benefit off of them, after 24 months, no matter how old they are, they'll start getting Medicare, which, like I said, is a very nice benefit as well. Medicaid doesn't typically cover prescriptions like we touched on, but by paying, you can pay a Medicare premium, which this year is $148.50. And that can give you that Part B, which is doctor's visits, and Part D, which is your prescription coverage. And that also can be taken out of somebody's SSDI check automatically. So you don't even see that money. You don't even have to worry about paying that money. You don't see that money. It can come out of their benefit check. And then that person will have Medicare Parts A, B, and D, which covers hospital visits, doctor's visits, and prescriptions. And then also Medicaid, so anytime once Medicare is done paying, Medicaid will typically jump in and will cover a lot of the remaining costs. So just wrapping it up here, first steps towards receiving HCBS waiver is applying for Medicaid and going through the application process. People with disabilities, both children and adults, are all eligible for Medicaid. If you are applying for an adult, even if they're still living in your home, remember to just fill it out as that person, as you were that person. And you'll sign, towards the bottom, you'll fill out the last page where it says that you filled it out for somebody else. You can maintain that Medicaid coverage by paying in a spend down or submitting any of their health invoices throughout the month to maintain that eligibility. And once Medicaid is received, do reach out to DMH or the regional center, they're interchangeable, to start the support coordination services. And then that will begin your process of HCBS waivers. So I will stop here and let Ann take over.
Thank you, Kristen.
You're welcome. Have fun.
All right. So we're going to dive into a little bit more detail, but this will be very some repetition, but I think repetition can be good because that's how we all learn. So we're continuing to talk about home and community-based waivers and Medicaid, what you need to know to access services. So here is the second screen, which has the website. So you're going to apply for the Medicaid program, and you're going to go to this website to do that. And you're going to look under for people with disabilities to apply for that. The second step, once you have your Medicaid, and even before that, so while you're waiting to hear from Medicaid, you can apply for services through the St. Louis Regional Office, which is part of the Missouri Department of Mental Health. If you live in St. Louis County, you're going to call this number. If you live in St. Charles, Jefferson, or St. Louis City, you're going to call this number. When you call this number, they don't need to ask for a support coordinator through the regional office. They need to ask for an intake department. The intake department will be the people who will start this process for you. Once you have made it through the intake process, then you will be assigned to either a support coordinator or you'll be assigned to an information coordinator. If you have Medicaid, you will be assigned to a support coordinator where you will be potentially eligible for a Medicaid waiver to pay for some services and resources. If you do not have Medicaid, you still may be eligible to have an open case with the St. Louis Regional Center, but it is going to be with an information coordinator. And right now there are 5 information coordinators throughout the state of Missouri that take care of all of those needs for people who don't have Medicaid. So the next step in your process is you can run after the waiver, but the most important thing is what are the current and future needs of your family member? I think this is a really important piece because if you don't know what you need, you don't know what to ask for. And not only that, but it's possible that some of the things that you need can be taken care of through other means besides a waiver. And there are not enough funds to go around to every single person to put up your laundry list of things that you need. So the first and most important thing is to access what it is that you actually need. So I'm going to stop sharing again for a minute, and we're going to use an example of what that means. Oh, I see we have some questions, so let's take a look.
Oh, we got the first one's kind of a mixture.
Okay.
I was told that if Medicaid paid my son's Medicare premiums, he would lose his Medicaid benefits. Does that include waiver as well?
So if Medicaid pays your son's Medicare premium, he will not lose his Medicaid benefits. However, if he were to lose his Medicaid benefits, he would lose his access to waivers. So no, that is an untruth or a misnomer. If Medicaid pays for Medicare premiums, you still have Medicaid and you have Medicare.
All right. That's what I would have said as well. Okay, and then the next one, my daughter is 19. She's been on MoHealthNet for years. She also receives SSI. Does she have a case manager? She does have a case manager and has a waiver for PCA, which we don't have anyone yet for her. Are we on the right track?
You are on the right track depending on what you want that PCA service to do for you. If you want it to be a break for your family, then you're on the right track. If you want her to learn independent living skills and the PCA person isn't doing that, then you're not on the right track. So part of it is being able to determine what it is that your needs are. So one of the things that we're going to look at right now is that integrated STAR, and we're going to look at an example of community living, because a lot of people are concerned and interested in residential services. It doesn't have to be the only service people are interested in, but it is a popular one. So I'm going to try to share my screen so I can show you an example of what that looks like. All right, so this is what we call a STAR. It's got 5 points. I'm going to scroll up and down. So we're looking at community living support options. So what are the things we want to look at? When you're looking at programs and services, you want to look at what is going to make the best situation, the best life for your family member. And it can be something that you want to look at right now for the moment, or it may be something you want to look at in the future. So for the first thing, if we're looking at community living, is what strengths and assets does your family member or others bring to the table? So maybe this particular individual drives or is able to ride the bus, or maybe they can take a cab. So maybe they can't do all those things, but maybe they can do one of those things, or maybe they're able to call a ride. So knowledge of how to navigate the community. Maybe they know where certain things are, the grocery store, the arcade, whatever. Maybe they can prepare simple meals. So all of the things that they bring to the table are going to make a difference in their life as they become more and more independent and are able to live with less support. Maybe your family member, you want to take a break, but they can't stay by themselves, or you don't think they can. Maybe some remote monitoring so that they can stay by themselves for an hour or so, and you can watch them and they can contact you if there's a problem. So maybe it's an adapted living space where things are safe, accessible, easy to use. There are all kinds of technology and devices out there to help people be more independent. Even something as simple as an electronic reminder so that they can be more independent. What about relationships and community supports there? So we have parents, perhaps, maybe some siblings, children, spouses, grandparents, other extended family, friends, roommates, neighbors, peers of the same age. So all of those things may help them live a much fuller life and help them to be as independent as possible. Because if all of those folks, even if someone is getting care 24 hours a day, having people who come in and out of their lives is going to help strengthen the monitoring that goes on and the quality of life they have. And then we have community resources. So maybe you buy a home for your family member and they live in it, and then all that's going to be paid for is the staffing. Maybe it's a co-op. So you have several people living together and there's sharing staff. Maybe there are homeowners associations or neighborhood watches or things like that that are going to help this person, again, be more independent in the community by using community resources. And then finally, we get to the resources that are eligibility specific. And then you're talking about group homes. You're talking about host homes, independent living. You're talking about independent supported living, where somebody might get a certain number of staffing hours per week or per month, or everything up to 24/7. So you want to know where you're going so you know how to get there. And then you can start asking for things. So I'm going to go back to the slides. So the next steps in the process for accessing a waiver, now you know what you want to ask for. So think about what your goals are. And I'm going to use the example of the participant with the PCA service. Yes, you are on the right track as far as you have a waiver and it is paying for services. What's nice is you'll be able to utilize the waiver to determine if there are other things that you need besides the PCA service, or if the PCA service is the actual service you need and want and it's working out well for you. So the first thing you're going to do if you have a support coordinator, once you have that person, is you're going to complete an individual service plan. And that is basically taking your general goals and making them very specific. They're going to look at everything related to your family member. So that might be their health and safety, their independent living, their daily living, what they want to be doing during the day, their medical needs, all kinds of things. So that's all going to be in the plan. And that's important. And then you're going to prioritize the things in that plan. What are the things, single or couple of different things that you want to focus on first for that year? The next thing that the support coordinator would do to try to get you services through a waiver is something called a MOCABI. And this is a screening that's called the Missouri Critical Adaptive Behaviors Inventory. And there's information here. I'm not going to go there because I'm afraid I'm going to lose my place again. But the website is here, and you can go there and look at the questions that are asked on that MOCABI application. And you can see it's going to ask all kinds of information about independent living skills, whether your family member can do certain things by themselves, stay by themselves. Are they, what can they do for themselves? What can't they do for themselves? What are the supports that they need? So, and then when that's completed, then they're going to score that. And then there is the scoring criteria right here that talks about how it is determined whether, how someone is doing on this application. The next and final, well, not final step, but the next step is what's called a prioritization of need score. And it has a list of questions. I will tell you that unfortunately, it is a situation where we're looking at deficits rather than strengths. So while your ISP may be looking at strengths, the priority of need score, the questionnaire that's done there, don't downplay anything that's going on in your life. If there are serious needs going on, make sure you bring those to light, because in that priority of need score, that is going to determine the score that you get. So, for instance, people could get a 1 or they could get a 12, depending on how they answer those questions. And the questions are based on a variety of needs throughout the state. So for instance, if someone is homeless, they get a 12. If someone has lost both of their parents and they're not sure where they're going to go next, they get a 12. So depending on the situation that families are in, they may get a 12. If someone has an 8-year-old and the 8-year-old is displaying a number of problematic behavioral concerns, then they may get intervention, but they're not going to get a 12. So that's how that works. I'm going to pull up that that priority of need score.
So while you're pulling that up, we had somebody ask any examples of how people score on PON scores. What can I expect?
Yeah.
I mean,
So
I think a lot of that is, yeah, go ahead.
Yeah. So let's let me pull that up again. Let's do the screen share. Yeah. So we're going to look at this PONS. Hang on.
Okay. Yeah, we have a couple just about PONS and waivers, which I think you're touching on now.
So you'll see some questions down here, and I'll have to read some of these. But in the last 3 to 6 months, is there a young adult aging out of their waiver? So there is a waiver for children 18 and under, and we're going to talk about that in a minute. So young adults aging out of their waiver. So or an Olmstead issue. So this is someone maybe who ended up in a nursing home who doesn't belong there because they're in their 20s. So, and they want to move out. So that would make them a high priority. A court order. So these are some of the things that people have to answer. Has this happened in the last 3 to 6 months? And then there are sections throughout. It goes on and on and on. How do they, are they mobile in the community? How are they about taking medications, using the telephone? So this serves a couple of different purposes. It will be scored based on a combination of unmet needs, because they are unable to do that service or that skill, and there's no one else to help them do that skill. So they're going to walk through all of these. If you get a low score, like a 1 or a 2, it means you just need to keep moving forward. If you get a high score, like an 11 or a 12, then you are going to be looked at for a waiver. So sometimes there are alternatives to that situation. Here's a question. So if my son does not need residential care now, but will someday in the future, should I still apply for a comprehensive waiver now or just a community waiver to help with the day program, since I understand they're easier to get? Can he reapply for another waiver at a later time? Absolutely. Yes. So you can apply for a waiver at any time. And once you go through the PONS, it will determine what your score is. And like I said, if it's low, you're not going to get a waiver. So there are all kinds of, not all kinds, but there are a variety of waivers out there. The first one is the waiver for kids with autism called EMAP, or Eastern Missouri Autism Project. And that is a waiver that has a small amount of money in it, less than $3,000, I think. And it provides a variety of services to kiddos. So things like ABA therapy and respite care. And I'm trying to think what else. Let's see if we can pull up the.
And do you know, couple questions here. I think they're all kind of asking the same one. What do you think the lowest PON score in order to receive a waiver would be? Do you think
it depends on funding? It really does.
Yeah. I've seen 9s and 10s.
Yeah. Right now we're still it still has to be pretty high.
Yeah.
But it depends on funding every year. And the funding is based on what the legislature will give to the Department of Mental Health in order to fund those services. So EMAP respite doesn't necessarily differ from ARC respite. You can use both. You can use your EMAP to supplement your respite to pay more. So it can be used in a general way or a specific way. So EMAP is the first waiver. It covers a number of services for kids living at home. And like I said, it's a small amount of money that can be used for a variety of therapies and services in the community. The next waiver is called Partnership for Hope, and that has a $12,000 cap, but you can get a variety of services through that. So again, it may not cover a whole day program service, but it might cover personal care assistance. It might cover technology to help your family member learn to be more independent. If you have someone who's kind of on the fence and maybe they could stay at home alone a little bit longer or be a little bit more independent in the community if they had some of that technology, the Partnership for Hope will pay for that. So it pays for a variety of services. The community waiver is the second to largest waiver, and it typically pays for large ticket items like a day program. It also helps pay for transportation to and from a program. So those are some of the things covered under the community waiver. And then the comprehensive waiver is the largest waiver. It doesn't have a cap, and it is used mainly to pay for residential services that are needed 24 hours a day, 7 days a week. So not everybody needs every waiver, or not everybody needs a comprehensive waiver. So it's important, again, to know what it is that you're looking for your family member. And once you look at that Medicaid waiver listing and what's covered, it helps you to make a plan for what you need to do to move forward. And one of the things I will tell you, there is the home and community based waivers. So also called the Missouri Children with Developmental Disabilities waiver, also called Sarah Lopez waiver. This is the waiver that pays for things like behavior therapy, respite, personal care assistance, medical equipment, and transportation. And this is for kids 18 and under. So this is a waiver that helps it's very difficult sometimes to qualify for Medicaid when you have a child that's 18 or under, because they're going to look at, even though they're going to take some leeway with the fact that you have a child with a disability, they are still going to look at large portions of your income. And so it's difficult to get Medicaid when you have a child 18 and under, unless you're really in fairly, your income has to be fairly limited. So this waiver allows families to use these services without having Medicaid. The next waiver is the Partnership for Hope waiver, which I talked about before. So it's just over $12,000 a year. And it includes assistive technology, ABA, even career planning, which can be a really good resource. Dental. So if you need to have your family member get some dental work done and Medicaid's not covering it, that may be something you want to look at. So knowing what your needs are and what your goals are can really help. So the next waiver, again, this Partnership for Hope waiver is for people over the age of 18. The community support waiver, again, has a cap of $28,000. And it covers things like assistive technology, day programs, job development, respite, transportation. I'm not sure what crisis intervention looks like, but it does cover for that. And they need to have Medicaid and be eligible for services through the Department of Mental Health St. Louis Regional Office. And then we talked about the comprehensive waiver. It's the only waiver that pays for residential services, and there's no cap. So let's say that you are in a waiver now because you only need some assistive technology. And then something changes in your life. You can go back to your case manager or your support coordinator and you can say, our situation has changed. We need a new priority of needs score because somebody's passed away or somebody's become ill or something's changed with the family member, and they can look at that and make a change. So it's not something you're going to want to try to fix and change, every several months in terms of your score. Your score is not going to change unless something in your situation changes. So once you fill out that priority of need score, you won't need or want or be able to do it again until something in your family changes. And no, if someone has a community waiver, they don't get a Partnership for Hope waiver. Each waiver has specific needs that it meets, and there's overlap. So usually what happens is whatever's in the Partnership for Hope waiver is also in the community waiver with more. And then whatever's in the comprehensive waiver is what is in the community waiver, but more. So it's more like a level of funding that you would receive based on what your needs are.
And also on that, just from experience, that Partnership for Hope waiver, especially if you're looking for day services, you won't be able, the amount that the Partnership for Hope waiver covers isn't great enough to cover many day services. So if they wanted to go full time all year round, a lot of times there's not enough money in that.
Right. However, if they're only wanting to go to try it out, maybe just a day or two a week, or maybe they do something else, you could use a Partnership for Hope waiver. So Kristen's right. That makes a lot of sense. Someone just asked a great question. My daughter has the Partnership for Hope waiver for PCA. We have been trying to find someone for her. Is self-direct the best way to go, or go through a company? Difficult to say. The biggest issue that you are facing is the fact that there is a lack of personnel available to provide services. So if you go through a company, you're going to wait until they can find staff to provide the service. If you go through self-directed, you're going to be hiring on your own. You may have a little more control over where you market to find people, but you're also going to struggle with finding people because there is just a lack of personnel available to do the services. One of the things about self-directed that makes it a little bit more enticing also is you might be able to pay a little more than you would through a company. So that might make a difference also. But no matter which direction you go to get your services, people are finding that there is a lack of personnel available to provide those. And part of that has to do with pay structure. And part of that has to do with just in general, you see help wanted signs everywhere for good staff. But I will tell you, we have family navigators. We have a family navigator that works with birth to 13-year-olds and another family navigator that works with 14 to 25-year-olds. And then I work with 26 and older. And what we do is help families get through the maze of services to get where you're going. So we can offer either a beam of light or some information or a helpful phone call or whatever you might need to help with the waiver process. Our application was denied, reporting they did not receive our application. What to do next? I would say to reapply. What do you think, Kristen?
Yeah, unfortunately, that's the only thing I can think of. And just keep sending it in maybe until you get confirmation that they have it. You can't really appeal because you don't have anything to appeal yet. Because if they didn't receive it, I don't know, that one gets a little tricky. And because if they're claiming they didn't receive it and they were denied, there may not be anything on Medicaid's end to appeal.
Right. I don't know that it would be an appeal. I think you would just reapply. And I would reapply online if you didn't.
Hi, so it's me that, posting all of those questions. So I have the FedEx confirmation that they actually received our application.
Okay.
But the reason for the denial is that they say they didn't receive it. So I just wanted to know if there is any way we can appeal in this situation, or any way we can contact them to see what happened. Because as I said, we have the confirmation that they received it.
I see. What should they
Well,
do?
I mean, if you have, do you have the document with the decision saying that they denied it? Yet that actual document was mailed to you?
Yes.
So in that case, towards the back of that, there should be a process to appeal. If you have a document from MoHealthNet or from Family Support Division saying that they absolutely got it, that you could try to appeal it that way. I kind of feel like you might have to just reapply, but you can definitely try to send in that document and any confirmation document that you have and appeal it that way. Biggest thing with appeals is just making sure that you take the time to go through all the details and keep those documents, so then if something does come up, you have it. Because the more you send in, the better a lot of times. But just making sure that what you're sending in is specific to the reason that you were denied.
Hey.
Yes, I just had a question, and I'm not sure if I heard this correctly, but I thought that I heard if you are, if your child, my daughter's 20, she has Medicaid, are you automatically eligible for Medicare after a certain period of time, or no?
So after somebody has SSDI benefits for 2 years, for 24 months, they're eligible for Medicare. So that would be a benefit off of either you or a spouse's work history, if either of you are retired, or if a spouse has passed away and your daughter's getting a SSDI benefit. After 24 months of having that, she would be eligible for Medicare.
Okay, she gets SSI. Is that different from SSDI?
Yeah. Yeah.
So she would get Medicaid, SSI and Medicaid, and she would only get the Medicare. If she had a work history, or she had yours or her dad's work history, and she and you all retired or passed on.
Yep.
I see. Okay. Thank you.
If under comprehensive waiver, my son is living in an ISL or whatever residential, who is going to pay? Which funding source is going to pay for the rent?
That will be paid for first with, if he gets SSI, some of that will be used towards his rent. And then some of it, depending on where he would live, might be Section 8, which is federal money.
Okay.
And then the rest would be through the waiver.
Okay, got it. Yeah, I think I'm clear now. Thank you.
Yes, hello.
Hi.
Hi, I have a son who is 20 years old. He is currently receiving SSI, and we are currently in the process of going through the process to get Medicaid. I've gotten my second round of, them asking for the copies of bank statements and things like that. But I guess my question is the Maccabi. I have not looked at that yet, but I'm looking forward to taking a look at that this evening to see what type of questions are on that application. And I'm wondering, because my son, if you were to say to me, can he independently take a shower? Well, the answer would be yes, physically he can.
Mm-hmm.
But he might go in and turn on the water and let it run for a couple minutes and then turn it back off. He might even get his hair wet to make you believe he showered, or he might tell you he showered but not shower. I mean, and that's like, can he physically take out the trash? Can he physically stay alone? The answer technically to those questions would be yes, but would he actually do them? Would he be safe when he's home alone? No. So when you're going through the questions on the Maccabi, is that like, I guess my question is, you know, like the woman earlier said, like her daughter on paper may not qualify, but yet she should. So what state of mind do you go to when you're answering these questions?
You answer them as truthfully and as accurately as you can. You don't want to sugarcoat anything, but you don't want to exaggerate anything either. But when you see the questionnaire, it's going to have things like totally independently, with reminders, hand over hand assistance. It's going to have like 4 categories for each answer.
Okay.
So it's not like, can you do it? Yes or no.
And
It
I think
actually-
a lot of, go ahead.
Yeah, it actually goes into detail.
That's helpful to know that that is there. Okay.
And if it's possible, I mean, I know clearly not everybody is able to, not everybody uses their words, but, you know, ask the questions to your son or daughter and say, you know, if I were to leave and somebody knocks on the door, what do you do? Or in less words, or however it works, however that communication is with them, because that's going to help you answer it as best as possible, and therefore also getting that, you know, the best data back and helping with that score as well.
Okay. All right. Okay. Thank you. That's helpful.
Good. So thanks again, everyone.